Good afternoon, everybody from across Canada. We are so happy to have over 300 people from across Canada joining us today for Ostomy Canada's next national webinar, this time titled The Battle of the Bulge, Stomal Hernia Prevention and Care. And we're really excited to have our guest speaker today, Leslie Heath, who's going to be presenting on this topic. It's going to be a little bit of a longer one today, and the reason for that is because we really want to make sure that we had an opportunity to answer as many of your questions that came in, and we had quite a few that did come in before the webinar. So Leslie and myself, we've done our best job to get all those questions answered. That said, we are going to be happy to have any questions that do come up throughout the presentation. Feel free to ask those. I'm just going to quickly describe how you can ask a question. So on this platform that you're on right now, you should have an option that says ask a question in the Q&A panel. If you click on that little Q&A icon, you'll see an option to select ask a question at the bottom of the pane. Then you just need to type your question in the compose box and select send. If you want to ask your question anonymously, your name will be optional and you can leave it blank. Then select post as anonymous before you send your question. So we're going to be able to see the questions that come in. Ideally, we're going to be able to answer it throughout the duration of the presentation. And as I said, because it's a little bit longer, if we don't get to all your questions, don't fret. We're going to be taking those questions to make sure that we can help inform other topics in the futures, whether it be for a webinar or for articles or something that might be on our website. And we will, of course, mention our medical lifestyle advisory team that you'll be able to get in touch with through email at the end with more specific questions. So today, if your video hangs or kind of buffers at all, one of our main troubleshooting options is just to close and rejoin the session by clicking the same link that you got in your email. But we hope it doesn't happen for you, of course. Our session is going to be recorded nonstop, so keep in mind you're going to be able to, if you come back in, start watching from where you left off. It's also going to be recorded and made accessible to everyone across Canada after today's session is over. Without further ado, I'm just going to quickly introduce our phenomenal guest speaker, who you may have heard from already with Ostomy Canada. Her name is Leslie Heath, and she's a certified nurse specialized in wound ostomy and continence, who has practiced in both community and acute care centers since 2009. She also completed her Master's of Clinical Science in Wound Healing at the University of Western Ontario in 2012. As a clinical nurse specialist at the Toronto General Hospital, she provides consultation and treatment recommendations, education and advocacy for patients with wounds and ostomies. Her role also entails providing leadership, mentoring, and provision of education to patients and staff, as well as program development, quality care monitoring, and participation in research. So on that note, I'm going to pass our presentation over to Yasser, who's behind the scene, and he's going to be able to play our recording. I look forward to seeing you back around for the Q&A portion at the end of the presentation. Thank you, everybody, and enjoy.
Good afternoon, everyone. Welcome to this presentation on the Battle of the Bulge, Stomal Hernia Prevention and Care. My name is Leslie Heath. I'm an NSWOC, nurse specialized in wound ostomy and continence, and it's my privilege and honor to present to you today. Today's objectives are discussing what is a parastomal hernia, the incidence of parastomal hernias, what options are available once you've developed a hernia, how to prevent parastomal hernias, what to do if you have one, and what options are available in the area of hernia belts and support garments. I have nothing to disclose prior to this presentation. So what is a parastomal hernia? It's a type of incisional hernia that occurs right around the stoma. So right at the incision point where the stoma or the loop of bowel has been brought out to the surface of the abdomen, or just immediately around it. When a stoma is created, a slit is created in the abdominal wall muscles and into the skin, and the stoma or the bowel is brought out through to the surface, turtlenecked open and sutured in place. This natural weakening in the abdominal wall leaves people with weakened muscles in that area, and over time and with repeated use, the muscles and the tissue around can actually weaken and allow for the protrusion of the bowel, both from inside and or around. Unfortunately, it's one of the most common late complications of stoma construction. So what are the common causes and risk factors that are specifically patient related? So unfortunately, older age, and we are finding that we are doing these abdominal surgeries with stoma creation in older and older people. I think the oldest person I've operated on was 96, I had the pleasure of caring for. Unfortunately, obesity gives you a high risk for developing a parastomal hernia or any hernia of any type. Weak abdominal muscles, whether it be from lack of exercise prior to surgery, deconditioning due to other illnesses, or again, due to age and lack of mobility. Poor nutritional status. So malnutrition is very common, again, in the elderly, but especially if people have been ill or gravely in hospital for a long period of time before they have their stoma constructed, then that leaves them at higher risk for parastomal hernia formation down the road. Smoking is another big one. So if you can cut out smoking prior to your surgery, that's huge, but even after surgery as well, because smoking impacts healing and all parts of your body as well. Multiple abdominal surgeries. So if you've had to have multiple surgeries, every time the surgeons cut into that abdominal wall muscle, you're weakening that muscle and leaving that open to possible hernia creation, not just parastomal hernias, but any kind of hernias. It could be incisional, could be umbilical right at your belly button, could be ventral hernia, could even be in the groin area as well. Excessive force in the abdomen. So unfortunately, after surgery, we're always teaching people to cough and do deep breathing exercises, but we encourage you to support your abdomen by using a pillow so that you're supporting those abdominal wall muscles. As people recover and get home, they tend to forget and we all get busy. And so anything that causes intra-abdominal force, coughing, sneezing, vomiting, lifting heavy weights, straining, or even with heavy exercise, any excessive force in the abdomen can cause a hernia to develop again in those weakened abdominal muscles. Comorbid disease, unfortunately, people that have connective tissue disorders, diabetes, other malignancies, inflammatory diseases, breathing disorders such as COPD, and people with ascites, where the skin is very thin and stretched because they have a lot of fluid in their abdomen. People on medication that are immunosuppressive, such as steroid medication, have a higher risk, again, because healing and tissue strength is impacted. And people with a risk of recurrent infections, unfortunately, have a high risk factor as well. Surgery related. So from a surgical standpoint, when the surgeon does the operation, obviously they don't intend to give a parastomal hernia, but unintentionally, sometimes what can happen is the opening through the abdominal wall where they bring the bowel through is made too large, or it's too big an opening. And so it allows that bowel to slip through afterwards, again, with a higher strength of intra-abdominal pressure, as you can see in the picture on the left. If the stoma site is located outside of the abdominal rectus muscles, now this is a bit controversial in the literature. Typically we are taught, and the surgeons are all taught, to create the stoma inside the rectus muscle because that's your strongest muscle and that helps to protect and keep all your internal organs in place. But sometimes stomas can be or must be created, not can be, but must be created outside of the abdominal rectus muscle. And there's some theories to say that the increased risk of herniation is greater, but again, that hasn't been proven in research. But for safety's sake, right now, the surgeons are currently still creating the stoma sites within the rectus muscle. And so that's why the preoperative stoma siting by an NSWOC or the surgeon is very, very important, so that we get it in within the rectus sheath, which is the abdominal muscles, and so that you have the best chance of having that stoma and that protection from the hernia developing. Emergency procedures, again, often related to preoperative siting not being done. A patient goes rushing off to surgery and doesn't have time to have the NSWOC site them, or the surgical team unfortunately doesn't have time to do a proper siting, which takes a few minutes because there's several things that we do take into account. When the literature was examined for this presentation, and there's been several recent papers that have looked at the differences in surgical techniques on how a stoma is created, there is nothing that necessarily contributes specifically to having one surgical technique. For example, a laparotomy, which is an open surgical incision versus a laparoscopic, which is the keyhole. And there's other surgical techniques as well, but those are the two primary. And right now, there is no specific difference in whether one is done over the other and the impact on the creation of the hernia down the road. That is certainly something that the surgeons are looking into, though, for sure. So what does a hernia look like? So the physical appearance, most people find that they just notice over time that there is a little bit of a bulge that happens in the abdomen around the stoma. Many people are asymptomatic and they don't feel it, they don't notice it. They just kind of look down one day and they see this little bulge and they go, what's that? And for some people, it increases in size over time, and others it stays the same size. As we discussed previously, coughing, sneezing, straining, or standing in a manner where your abdominal muscles are tensed can make the hernia a little bit more obvious. And that's when people tend to notice it more. You can notice that bulge right around the stoma or close to the stoma site itself. It's often looks like a baseball behind the stoma. And so the stoma is actually sitting on this big lump of tissue. For some people, it can be quite large, and for some people, it's a little bit smaller and more subtle. A small percentage of people have a mild abdominal discomfort or some back pain or some intermittent cramping. A lot of people that have a slightly larger hernia do report the feeling of heaviness or dragging down with them. And that's often relieved when they lie down and the hernia is reduced or goes back inside. The way to test if you have a hernia is when you lie flat, your bulge or the protrusion in the skin should go back inside and go flat and soft. And then when you stand up, you should notice it and create a little bit of tension with your abdominal muscles. You'll notice that that hernia will protrude a little bit more. So it'll be a definite difference between the two positions when you're lying. The important point is that when you're lying down, that hernia should go flat and soft. Okay, that's the most important thing. In severe cases where people are actually having an impact with the hernia and they're having difficulties that the hernia is actually causing problems with the bowel, they may have abdominal distension, they may have nausea and vomiting, they may have fluctuation in their bowel movements such as diarrhea to constipation. And the biggest clue that you need to seek medical attention is that when the hernia stays hard and you're lying flat, in combination with all of those symptoms that we mentioned above, the distension, the nausea, the vomiting, etc. For some people, the hernia is staying hard when lying flat. It takes a few extra minutes and then it eventually goes soft. And some people can actually gently manipulate and push with their hands to reduce the hernia back inside their abdominal muscle wall. But for others, it actually stays very hard and gets very uncomfortable. And that's when you need to seek medical attention. So what is the incidence of parastomal hernias? And there was a lot of varied incidence in the literature, and the incidence means the probability of occurrence. So there's a huge range, as you can see here. This is a paper that I found more recently in 2014. There was a couple others that were newer as well, but This one was more North American, but there is a varied incidence. So as you can see here, for loop ileostomies, it's anywhere from 0 to 6%. And of note, the end colostomies unfortunately have the highest rate of possible parastomal hernia creation, anywhere from 4 to 48%. And so that's a huge number. The timing, basically, it can be at any time. Some people can develop hernias within a few weeks of surgery, unfortunately, and some people can have hernias develop up to 5 to 25 years after surgery. So there is no safe time, unfortunately. Most often in the literature, when people have done research studies to determine when hernias develop, most often it's usually within 2 to 5 years. But there has been reported incidences of hernias being created, many, many years after that. So it's very varied, and unfortunately it doesn't give a lot of reassurance as far as, you're in the safe zone. The overall incidence for any type of stoma, when you look combined, is 11 to 80%, which is huge, unfortunately. Typically, when we're doing the NSWOCs or the surgeons are doing their preoperative teaching, we talk about the risk of hernia creation, and some surgeons will quote statistics and say, 60 to 80%, and some just don't. They just say that it's a possibility, but hopefully it's one of the risks that is discussed in the pre-op setting. So how is a parastomal hernia diagnosed? So most often, number one is based on physical examination. So you go in to see your NSWOC or you go in to see your surgeon. Those are the two people that are most specialized to be able to identify a parastomal hernia. A lot of other healthcare professionals don't necessarily have the knowledge and the skill to be able to identify. Most of the time, you can notice it, as I said, in the standing position with a little bit of straining of the abdominal muscles, which is called the Valsalva maneuver. And if you look at the picture on the right-hand side, where the person is looking down, you can just see sometimes it's a very subtle bulge around that. Often it's around the tape part of the flange. And on the middle picture, it looks like it's a little bit larger. Occasionally, for some people, a CT scan or a CAT scan will be ordered to make sure that they confirm the physical findings, but oftentimes it's not necessary if it's an obvious bulge. If you put, a patient between 2-3 different doctors, 2 out of 3 will say, yes, that's a hernia, and the other one will say, no, it's not. But basically, if there's any question that there's a hernia there, there's likely a hernia there. And it's very complicated. When you look at the parastomal hernia classifications, I'm not going to go into too much detail, but I just wanted to show you that it is complicated because there is different kinds of hernias that can present themselves. So some are just underneath the tissue, some are just underneath the skin level, some come from within the bowel or the lumen itself, and some is from the whole loop of the bowel prolapsing or protruding out. So on an outside examination, you're not going to be able to differentiate. All you can see is the bulge in the patient's abdomen. So I didn't put these pictures here to distress anyone, but I just wanted to show that this can have a huge impact on some people. And some people, it's a very complicated thing. And so the top picture on the top right, you can imagine how distressing it is for that particular person and how large that hernia is. And we see hernias this size in patients without stomas as well. So just because you have an ostomy doesn't mean you're going to get these large hernias. For a majority of people, they're small, they're a slight bulge, they can be conservatively managed. Only a rare few actually just protrude and extend out to be as big as the pictures that I've put here. 99% of the time, the surgical team and your NSWOC team will recommend conservative non-surgical management. It's very, very tricky and very, very risky when assessing a hernia and what to do with it. And there's many factors that need to be taken into account. Most of the time, these hernias can be managed with a hernia belt to offer support and provide support to those abdominal wall muscles so that you prevent the hernia from getting larger, but also to make the person more comfortable so that it's not feeling like they're having such this heavy pull of the bowels protruding through. You may have to look at refitting your pouching appliance if you're having skin leakage and skin breakdown. As you can see on the bottom right-hand picture, it looks, as I said, like a little baseball that's behind that stoma and the appliance. And so you need to change from something that's very rigid to something that's very soft, that's going to conform around a round surface. And this is where it's very important to go back to see your NSWOC to help with pouching and fitting, to making sure that you're getting an appliance that works well for you. Unfortunately, having a hernia, especially large hernias such as these pictures, causes people to have a significant psychological impact. It's very, very distressing to have these hernias, both the impact on the quality of life and the concerns for body image. So, what clothing to wear, can I go out? People are going to notice it, things like this. This is a huge impact on psychological distress. And unfortunately, this is something that is not going to necessarily have a magical cure, but hopefully with a combination of things that can be done to help reduce things and make it a little bit better, so there's a little bit better quality of life. So from a surgical standpoint, hernia management, and again, I just want to say that this is very, very complicated, and surgery is not the #1 choice because it has its own risks that are inherent with it. So in the top left-hand corner, you can see there's a hernia where the patient is lying down, and that hernia bulge has stayed firm and hard, as I was describing. And those are signs where you've got that hernia that has stayed out through that weakened wall of muscles and is not going back inside. And so you've got increased risk of obstruction or blockages. You've got this hernia that's staying out, and that's having an impact on bowel function, whether it be diarrhea or constipation in the fecal stomas. You've got constant or chronic moderate to severe abdominal pain and cramping. You may even get bowel strangulation. So the bottom left-hand picture shows the protrusion of the bowel through the abdominal wall beside the stoma. And it can get strangulated, and it actually can cause bowel death, which means emergency surgery. So this is where, if you're getting that abdominal cramping and that pain, and you get to the point where you're nausea and vomiting, it's very, very important to seek medical attention to make sure that you're examined carefully to make sure that there's nothing more sinister occurring underneath. And for those people that are having significant pouching issues, that would be one consideration, but it would have to be really, really significant pouching issues, something that the NSWOC has tried many, many times to try to fix, and it's just completely changed the size and the shape of the stoma, and it's near impossible to be able to pouch and keep an appliance with a good seal on. Then surgical management would be considered. But otherwise, the hernia belts and the exercise are going to be your #1 choice. So as I said, the surgical decision is very, very difficult. Each individual is examined case by case basis. There is no rule of thumb. There's a lot of risks and there's a lot of benefits. Timing is important. So, the surgeons will look at how long the hernia has been there for, how big it is, what is the impact on the patient, what are the comorbid factors, so what are the disease processes, or what are other surgeries. As I talked about, multiple abdominal surgeries make you at much higher risk for hernia creation. And if it's left too long, it can actually become much more complex, and then surgery is not an option. And I know that's very, very difficult for people to hear, but unfortunately, when the surgeons are weighing the risks versus the benefits, your life and your health is the #1 thought process, and that's the number one goal. And the complication risks may be too high. So in the literature, it reports that 11 to 70% of people require intervention that have large hernias, not ones that are kind of small, but ones that are large, like the pictures that I've put here. There is no ideal repair. There's several different types of repairs, but lots of different approaches, and there's no specific one that is one best over the other. So one possibility is stoma relocation. So moving the stoma to the other side of the abdomen and completely relocating it. Unfortunately, the risk with that is you've got a high chance of recurrence, even on the other side of the abdomen, because we still haven't changed the abdominal wall and the muscles and the risk factors that created the hernia or were present to create the hernia in the first place. So even if we relocate the stoma, you've still got a high chance of recurrence. Another potential surgical option is a surrounding tissue repair, to just go in and do a simple, what would be deemed as simple, repair around the stoma, and it's actually not that simple. It's actually more complicated, and again, it has a high risk of recurrence again. Again, it all comes down to tissue and abdominal wall and muscle strength. And again, all those factors that we talked about, age, obesity, smoking, things like that, all still will have an impact on healing, even with a surgical revision. And then the last option is mesh repair. And so with the theory with mesh repair is, as you can see in the picture on the top right-hand side, is they put a surgical mesh in to kind of hold the bowel up underneath the skin so that it doesn't have the opportunity. It's kind of supported there almost like a sling. And so it has less opportunity to actually bulge and protrude onto itself. Now, here's two surgical options I showed in this picture here as well. One is a keyhole surgery and one is the sugar breaker procedure. And again, you can see that they're meant with the mesh to kind of help to hold, to prevent the bulging from coming through. Unfortunately, there's some good success rates with the mesh, but unfortunately with the mesh, you've got risks of mesh infection, the creation of fistulae, and again, recurrence. And fistulas are holes in the bowel where you're going to be getting leakage of either urine or feces into either the abdominal cavity or on the outside beside the stoma. So mesh, a lot of people will read that mesh is a great option, but it needs to be very carefully considered with the surgeon and in conjunction with the consideration of all those other comorbid factors that we've discussed. The risk of recurrence, despite all the interventions, is still an 8 to 18%, so 7.9 to 7.8% risk of chance of recurrence. And so again, it's not a fix-all. And once you've had one recurrence, the surgeons are very reluctant to do a third hernia repair, because they kind of say, well, it's kind of it's going to be that much higher risk to reintervene again, and you've got again higher risk of recurrence again. I've known a couple people where we've done at least 2 parastomal hernia repairs, and unfortunately they both recurred, one within a year and the other one within a couple of years. And it's very devastating and disappointing to people and to the surgeons as well, because they try really hard to help fix you and to give you better quality of life. But again, that is the risk. In the literature, some of the conclusions were just that more studies needed to be looked into. There's talk about using the mesh as a preventative. So instead of doing the mesh as a repair afterwards, after this hernia has developed, to use the mesh prophylactically or preventatively ahead of time. But there's not enough evidence to support that use, and it comes again with its own use. Anytime you're using mesh, you've got a higher risk of infection. So again, that needs more studies. So how do we prevent parastomal hernias in the first place? And so unfortunately, it's very scary and rather unnerving to a lot of people. And some people this will have been discussed in their pre-op education. And some people are going to be upset to hear that they didn't hear about this. And that's unfortunate, as it is one of the high risk factors. And it's not to say that it should dissuade you from having surgery. It's just a risk factor. But it's nothing that can't be managed, hopefully, with some of the varying techniques that we're going to talk about. So when we're looking at prevention, so how do we prevent it in the first place? So again, in doing my literature search, there's a couple of different ways, but there's nothing that's been proven for sure, definitive, like you must do this. So again, I picked this gentleman overlooking the horizon, saying that there's many mountains that we need to be looking at. And it's not just one or two factors that we need to look at, a variety of things. So some of the things that are being explored, again, are the surgical techniques. So what the surgeons are doing and how they're doing it, both with the mesh and without the mesh. Exercise, both preoperative exercise to start to strengthen those abdominal muscles, wall muscles before surgery and after surgery, and the use of hernia belts, both as prevention and as treatment. Prevention after the stoma has been created, and treatment after the hernia has unfortunately developed. So for hernia prevention, what you can do, what can you do if you have any abdominal surgery, but especially an abdominal surgery that's had a stoma or an ostomy created? These are some of the tips that we recommend. So maintaining or losing weight if recommended. So we need a healthy body mass index. So having that body that is fit, that doesn't have a lot of abdominal fat to it, that has stronger abdominal wall muscles. Not to say that you need to lose, 50 pounds, 100 pounds, but you just need to maintain or lose the weight if you're severely obese. And by that, we mean over 100 kilograms. And it should always be done in conjunction with your surgeon, because we do need you to heal as well. So basically eating a well-balanced diet, and whatever the diet has been recommended to you after your surgery. Of course, stopping smoking has a big impact. Staying active. So, strengthening your abdominal muscles by even just moving. So just normal day-to-day things. The best exercise we always recommend, number one after surgery, is walking. Just, slow walking to start with, getting yourself moving, and then eventually you can do brisk walking and even power walking, where you're really moving your arms and your legs and getting yourself going, and getting that heart rate up. Doesn't have to be going to the gym and lifting weights to exercise and stay active. Something simple as walking or even swimming is very good for you. Avoiding heavy exercise too early. So using weights, anything above the shoulders, or rowing machines, or leg presses in the gym, or lifting heavy weights. We had a lady come into us who moved a refrigerator 5 years after surgery, and unfortunately moving that refrigerator was her downfall, and she felt an abdominal cramp and a pain and a little bit of a pop, she said, and then she developed a hernia. So being very careful no matter what you're doing, and using good body mechanics when you are moving, being very mindful of how you move and what you move, and lift when you are doing it. Some people will recommend a light support garment in the immediate post-op. So I put a picture, for example, down in the bottom right there, which is, it's like almost like a Spanx type garment. And I'm going to talk about some resources for that later on in my presentation. And again, most physicians and NSWOCs will recommend just gentle exercises that can be started 6 to 8 weeks after surgery, after you've recovered, doing gentle exercises to start to get those abdominal core muscles moving, and then slowly and gently increasing. So if you have a parastomal hernia, what can you be doing? So number one is a hernia support belt. You really, really need a belt to help hold those abdominal wall muscles, to give them support. It's like if you were to have a new pair of pants that were loose fitting, the first thing you're going to do is put on a belt to help hold them up. So same thing with a hernia belt. We need you to have it properly fitted. So you need to have an NSWOC or a proper belt fitter to fit you properly, because there's lots of various different things that we need to take into account when measuring. This can treat and prevent worsening so that the hernia doesn't actually slowly bulge larger over time. The good news is some insurance company will actually cover the hernia support belts if a prescription is given. And so if you're lucky enough to have extra private insurance, look into your insurance company and ask them if they will cover the hernia support belt as treatment. You may need to modify your ostomy appliance. So if you're using a convex flange, for example, as a hernia develops, it may change the shape and the size of the stoma. And so you may need to minimize the convexity so that you're not putting undue pressure around the stoma. You may need to go to a flat or even a concave appliance. Making sure that the proper fitting of the flange opening occurs. The stoma, as I said, can change shape and size. And so making sure that you're, as the hernia has developed and or if it changes over time, that you're making sure that you're measuring to make sure that you're getting a good proper fit. And unfortunately, you may need to change your appliance more frequently, just as that stoma shape changes with movement and mobility. So it depends on what you're doing. If you find that you're going to be doing a few days of, you're traveling or you're, going to work or you're doing something that has increased activity, you may want to just keep a close eye on the size of the stoma and the size of the flange opening to making sure that you're not having any trauma or any changes where you're going to have exposed skin so that the urine or the stool could damage that skin. Again, avoiding heavy lifting or strenuous exercise. We want you to go slow and gentle. Not to say that you can't do exercises and do, bodybuilding and weightlifting in the future. You absolutely can, but you need to slowly and gently work up to that. Okay, we have lots of athletes and Olympians themselves that have parastomal hernias with ostomies that still go on to compete at high levels. You just have to be very mindful and very aware and protect yourself. Again, staying active. So for most people, as you've recovered from surgery and you're starting to feel better and get back into kind of normal living again, we recommend modified core muscle exercises. So things that are yoga, like the strength, the slow stretch, hold and release. Pelvic floor muscles are very good. The pelvic floor muscle exercises, like your Kegel exercises. And then resistance training for the rest of the body, the arms, the legs, but again, slow, gentle hold and release. And then slowly work your way up as your core gets stronger, and then you can slowly get a little bit more active. In the beginning, your sports that you do, whatever activities you might be doing, jogging, running, cycling, may be modified a little bit, and then again, slowly work your way up as you gain strength and ability. Making sure that your diet and fluid intake is appropriate. As I said before, you may have changes as that hernia has developed. It may have a little bit of an impact on the type, especially for fecal stomas. So diarrhea to constipation. So making sure that you're eating enough fiber if you have a colostomy, for example, so that you're getting that bowel and that stool moving through and that it's not pancaking or restricting the movement. Weight maintenance or loss. Unfortunately, after surgery, a lot of people lose weight in hospital, despite our best efforts to help you not do that with various techniques that we do in hospital. But inevitably, people often will lose weight. So regaining to a normal weight is very important. So what your pre-illness weight kind of thing would be, or if you were severely obese, maintaining the weight loss and not regaining it is very important. But again, that should be done in conjunction with your surgeon or your doctor. We don't want you losing weight in an unhealthy way. Making sure that you're aware of the hernia changes over time. So, you know, things will change over time, as we all do, as we age, as our mobility and activity changes. And sometimes, unfortunately, that hernia can enlarge over time. And so just making sure that you're mindful of any changes that occurs and when to seek medical attention if needed. Unfortunately, as I mentioned before, it's a huge alteration in body image. So having this bulging hernia, for those that have just a subtle one, that it can be kind of hidden underneath your clothes, that's one thing. But for the people that have the hernias in those pictures that I've shown before that are quite significant and quite profound, it's quite distressing. You know, people feel very bashful and shy and don't want to go out or don't want to be seen. So they'll often compensate by wearing, you know, different layers of clothes, you know, timing when they go out, et cetera, et cetera. And so it's important to, again, have connection with your NSWOC who can help you modify what you can be wearing, what pouching system you're doing, fit you for a hernia belt, and just try and give you emotional and psychological support. It can be quite distressing. And so sometimes it's very important to maintain that connection until you kind of adapt and adjust. Nobody's going to ever love living with a hernia, absolutely not. But unfortunately, if surgery is not an option, we need to look at ways, and that's what the NSWOC will do, is to help you find ways to adapt and adjust and live with the hernia the best that you can, and hopefully prevent the furthering of the bulge. So one of the ways that we treat the hernias is with hernia belts. And so there's a lot of hernia belts, different types of hernia belts on the market. And there's a difference between a support garment and a hernia belt specifically. So a support garment generally refers to an adjustable belt. It can be a panty or a high-waisted panty or boxer shorts. They're often made of elastic, lycra, cotton, or microfiber materials. And some NSWOCs and surgeons will recommend to patients right after surgery that they can wear a light support garment, just again to help support those abdominal muscles as they're healing, to prevent herniation and injury in those first 6 to 8 weeks before you can start exercising. They're all very light and stretchy, but they're quite strong and can be easily laundered. If you've been recommended an actual hernia belt specifically, again, you need to be specifically fit. There's lots of different factors that are considered when we're fitting you for a hernia belt, which include the type of stoma, whether it's a fecal stoma or a urinary stoma, the type of pouching system that you're using, the size and the shape of the hernia, the size and the shape of your abdomen, and how it contours, the activity level, the height, the weight, and the dexterity of the patient. Hernia belts are a little tricky to put on, and most patients will tell you that they're often a bit of a pain in the butt, to excuse the pun, but they are very important. And so trying to find one that's comfortable, that's usable, that you are going to be comfortable and wear is better than having one that's been recommended that you absolutely hate and you never wear, and then you risk having your hernia possibly get larger or developing a hernia if it's used for prevention. So proper fitting hernia belt is very, very important. So the purpose of the hernia belt is also meant to reduce that pressure and that bulge and to really help support those abdominal wall muscles. And at the same time, they often help the appliance to adhere, because in some of the pictures I showed you earlier, you've got a flange that's trying to stick and adhere to a round bulge where previously it was a flat surface. And so that's why having your NSWOC help you with any appliance changes is very important. To put on a hernia belt, the proper way to do it is to lie flat on your back. So you're lying flat down, let the hernia reduce. So for some people, as I said, the hernia will reduce right away and your abdomen, your belly will go nice and soft and flat. But for some people, it may take several minutes, even up to 20 minutes for that hernia to actually settle and get back down into place. And so being mindful and aware of which category you're in, getting that hernia kind of back inside, and then having your hernia belt applied when you're lying flat. So you're going to apply one side. Most of them are all Velcro, and so they're easy to apply. But lying flat with your hernia reduced and then having that Velcro closure so that it's supportive but not restrictive. So we don't want it to be up and around your diaphragm so that you can't breathe, but we also don't want it down so low that it's actually not holding your abdominal muscles. So that's the importance of having it fit properly. You can see in some of the pictures that I've put here, you've got some hernia belts that have holes and some hernia belts that do not have holes. And in the literature, there's some controversy of whether the hole is important or not. And we say when you see your NSWOC to have your hernia belt fit, we often, one of the things that we take into account is the type of stoma you have, whether it's a fecal stoma or a urinary stoma, and the consistency. So for example, an ileostomy versus a colostomy. And then how severe the hernia is bulging, so how much it's protruding, whether it's a little bit or a lot. There's many, many factors that we look into whether we recommend with a hole or without a hole. Some of the theories in Europe and other countries are that they should be absolutely no hole because that's actually allowing for still the bulging of the stoma itself, and you could potentially develop a prolapse instead of a hernia or as well as a hernia. But in other cases, we find that it actually blocks the stool from coming out. Urine and ileostomy outputs less, but colostomies, we find it actually causes pancaking. It can actually cause leakage in some cases. So it really depends. And as I said, there's many factors that we take into account when we're looking at fitting you with a hernia belt. And so sometimes you'll be fit with one with a hole, and sometimes you'll be fit with one without. So when we're looking at exercise, again, very gentle, good old walking is your best core abdominal movements. Walking is number one form of exercise. You will often be given or sometimes be given exercises to be done about 6 to 8 weeks after surgery, which are the core muscle exercises. You can see the picture on the top left. Some of them are knee rolls, pelvic lifts, and the mini modified sit-ups. We don't want you doing full-on sit-ups because that's too much abdominal pressure. But anything that's got the gentle core abdominal movements that helps to just slowly and gently get those abdominal walls in place. As I said, as you recover and you get feeling better, more than 3 months, 8 weeks plus over surgery, you can gradually increase your exercise tolerance. We love to recommend things like walking, cycling, swimming, again, the yoga, Pilates. You can get back to resistance training. I have a balance board. I love my balance board. It just gives me that gentle resistance. It's a small little one, so it's nothing that I'm going to fall off of. Home exercise workouts are often all appropriate, the core gentle ones. Going back to the gym and doing the heavier weights, we recommend that you work with a physiotherapist or a personal trainer who has knowledge about abdominal surgeries and exercise after abdominal surgery, so that you do it in a specifically modified version and work up to it. Not to say that you can't do a full body workout in the future, but you're doing it in a mindful, slow, and very purposeful way. Sports are good. Sports are fine as you recover again and you slowly strengthen those abdominal wall muscles. You can golf again, you can play basketball. I love this picture that I put in of this young lady on the right-hand side in the middle who's done a Tough Mudder, it looks like. You know, you can be strong, you can be active, but again, just making sure that you're mindful of your movement, watching your technique, and watching if you're doing any impact sports. Building up slowly. So you wouldn't necessarily want to, you know, recover from surgery and then all of a sudden go and play you know, a full round of golf or go and play a full game of basketball. You have to really break yourself into it and go slow and just watch your technique, number one. If you feel heavy pressure around your abdomen or around your stoma specifically, and you feel like those abdominal muscles are being taxed or stretched too much, stop and pause. And as I said, seek guidance from a physiotherapist or a personal trainer. There's a couple of exercise videos on YouTube that you can look at. I put the links down here. These are affiliated with some of the companies that have references as well, which I will include in the next slide. And so again, these are the yoga and Pilates type exercises. They're very slow and gentle. The one on the left is from Clinimed and the one on the right is from Convatec. And they are very good. You know, these have been studied by research, in research and done by physiotherapists that have the knowledge and awareness of people with abdominal surgeries. And so this is done very mindfully and thoughtfully to get you started. So when you're looking at your appliance fitting, as I said, you may need to do some modifications. And so again, you can see from the pictures here, those bulges get very misshapen over time, especially the one on the bottom left-hand corner. You can see how misshapen that poor gentleman's abdomen is. And that's not even a parastomal hernia, that's an umbilical hernia or ventral hernia. And so, you know, having a support belt is going to really make a difference. Again, minimizing the convexity if you're using it, because the ostomy parastomal hernia belt can actually cause more pressure. If you've got convexity, you can actually get skin damage and injuries and ulcerations to the skin around the stoma. You may need to change to a flat flange or a mild convex flange. You may need to experiment with a one-piece versus a two-piece appliance. And we actually recommend applying the flange in the standing position when the hernia is at its largest. You know, typically we teach people to be standing in front of the bathroom mirror when they're applying their appliance, whether it be a one-piece or a two-piece. Some people feel more comfortable lying flat and having somebody else do it for them, especially elderly people who have difficulty doing it themselves. But when you actually have a hernia, what can happen is you can get that pulling force, that shear force on the skin when the person is lying flat, and when they actually stand up and the hernia bulges out, you can actually get some blistering and some ulceration occurring in the skin around. So we actually recommend that you stand and have the hernia bulging before you put the appliance on. And again, that stoma shape and size is going to change. And so you want it at its largest when you're actually fitting it. Some of the companies have developed new products to fit parastomal hernia bulges. So for example, one company, Coloplast on the right, has developed the concave flange. And so again, it kind of looks a bit like a starfish, but it's meant to, as you can see in the bottom right-hand corner, it's meant to conform and go around that round bulge that often develops with a parastomal hernia. You will often need a belt, both a hernia belt and or a belt specifically for the flange, but typically we recommend a hernia belt to give a wider support for all the abdominal muscles and not just focused on the flange itself. There may be some skin issues that can occur, and I'm going to talk about those coming up. And making sure that you're in contact with your NSWOC and or your surgeon for regular follow-up to make sure that the hernia is not, that the hernia is still benign and not causing you any issues. So when you're looking at the skin, I unfortunately put this picture in. I should give a little bit of a warning. It's a little bit of a scary picture, but that's an example of, again, a very large hernia and some of the skin changes that can occur. And so the skin can get very dry from the tape. It can get very irritated if there's leakage. As I said, the size and the shape of the stoma can change. And so we encourage people with hernias to look very carefully and inspect your skin with every appliance change, and you may need to modify what you're doing every time. With age and with the stretching of the development of the hernia, the skin can thin, and especially when you're taking your appliance on and off more regularly, unfortunately, it can cause inadvertent skin stripping, and especially if people are putting more pieces of tape around, which they often tend to do, then you can get skin tears and things, and you can see that dryness on the very outer aspect of the skin. And so being very, very careful with removal. You may need to use some of your accessories like adhesive remover wipes. You may need to help the flange stay on a little bit better. And instead of using tape, a lot of people like to use, unfortunately, the clear transparent tape, which can often irritate skin, especially over time. And so there's various things out there now, like the flange extenders and the skin barriers that can help protect the skin and extend the size of the flange to fit over that big round bulge of the hernia. Again, be very, very careful of the type of tape that you're using. If you are using it, the transparent tape can be used for a short period of time, but should not be used for a long period of time because it can cause a lot of skin damage over time. Again, applying that flange in the standing position when your hernia is at its largest. And if you've got pouching issues that persist, please, again, go back and see your NSWOC and see if we can make modifications and recommend different skin changes, skin accessories, and possible pouch changes to help get a better fit and seal to protect your skin. So here's an example, and I apologize, this is a bit of a busy slide, but I wanted to give you an example of some of the support garments that are available, and some are hernia belts specifically, and some of them are underwear that are specifically a lighter support garment. So you can see you've got anything from, you know, almost like a Spanx-like a comfort panty that has an extra firm tension across the abdominal wall area that does not necessarily have a hole for your stoma. And, you know, if you've got a urinary or a fecal stoma, it should still, it's a light enough compression or firmness across that it should still allow for the urine and the feces to come out. It's not too tight necessarily. And then you've got other hernia belts or support garments where you can see, for example, in the top right-hand side where you've got a full closed belt with no hole opening. And this one's kind of neat because it's got almost a mitten end. And so it makes it easier for people with dexterity issues like arthritis or weakness in the hands or vision issues. It makes it easier for them to apply that. Some of the other hernia belts you can see have holes in them to allow for the pouches to peek through so that you can makes it easier to empty them, whereas it still supports the hernia. So if you look down at the bottom middle, the Gord from Hernia Helper very kindly has shown his picture there of his belt. And again, you can see you've got a tight fit around that stoma, and it kind of gives that stoma the flange support as well, but is helping to support that abdominal wall. And it really kind of smooths down that hernia bulge so it's not so obvious under your clothes. The one on the middle right at the top called Stomaplex hernia belt, that's an interesting one. And some NSWOCs actually recommend that you wear a combination of an ostomy protective guard to allow for your urine or your stool to fall through, and then a closed hernia belt over top so that you're getting that pressure, but you're not obstructing the flow of the urine or the stool underneath. And so it's kind of a two-piece system. And so again, being in touch with your NSWOC to help figure out if that's appropriate for you. Again, it's not going to be appropriate for everyone. So for someone who's a little bit maybe younger and fitter and more agile and doesn't have quite the large hernia bulge, this would be perfectly appropriate. So you would wear a stoma guard and then the closed belt over top during, extreme sports, for example, playing tennis, the picture of the lady with the Tough Mudder, et cetera, cycling, that kind of things. That would be perfectly appropriate. And so this slide shows some of the company supports that are available. The manufacturing companies have been very instrumental in both working independently and with NSWOCs and physiotherapists in looking at exercise and hernia management for parastomal hernias, how to prevent and how to manage. And so here are some of the guides that are available. Again, you can see Convatec, Hollister, Coloplast, and the one in the middle is from Colostomy UK. And so there's various different ones that are available that are a good resource. So for my final few slides, I just quickly listed, courtesy of the Vegan Ostomate, who is a blogger who does a lot of really good reviews of ostomy things. And his list is fairly inclusive of various ostomy supplies. And I've just highlighted here some of the hernia belts. So for Canada, for example, there's a couple of different ones specifically. So Hernia Helper, that I've highlighted here, My Everything Store, New Hope Laboratories is in the USA, but it does ship to Canada. Premier Ostomy Center is a Canadian company as well for hernia belts specifically. Safe and Simple is US, but it does ship to Canada. Support X, the Ostomy Clothing Company, is Canadian as well. Tytex and Valco are all provide hernia support belts. But again, be in touch with your NSWOC and they can help you guide and support and fit you properly. Thank you so much for listening to my presentation on parastomal hernias. I hope I've been able to answer most of your questions in advance, but please feel free to submit your questions and we'll hopefully go through them in the next few minutes. Thank you very much again.
Awesome. Well, I just want to say a big thank you to Leslie again. I know that there were so many questions that came in, and I know there's some that came in live at this portion. We are just a little bit over time, so we're not going to have tons of opportunities to answer a bunch live at the moment. But as I mentioned at the beginning, we have taken every single question that's come in, both on this live webinar and that came in beforehand to our Ostomy Canada email. And we are going to conglomerate all those so we make sure that we do have a use for them in the future, and we'll hopefully be able to put out some information in the future. And that brings me quickly to my next quick point is that we are going to be launching on May 1st an absolutely new, brand new, great looking Ostomy Canada website. It'll still be the exact same URL, ostomycanada.ca, but you're going to see a beautiful new website with a lot of great tools and resources that are going to be existing on there. So stay tuned for May 1st. I'm just going to quickly come back to you, Leslie. I just want to say thank you to you. And Yasser, I'm not sure if you've got Leslie's camera up as well there, but hopefully everyone can see Leslie. She's tuning in from work right now, and she's done a phenomenal job with the presentation. So Leslie, I just want to thank you again. And I can just see from all the questions that came in here and some of the chat that we had behind the scenes that everybody's very engaged and do really appreciate everything you're able to cover in that.
Thank you very much, Troy. It's a topic that's definitely near and dear to my heart, and I welcome the opportunity to have the chance to talk about it.
Absolutely. Well, I want to thank you again. So I know we're over time, so we're going to wrap it up here. I just want to quickly announce to everybody else that our next webinar is going to be happening on Wednesday, July 20th. The topic will be announced shortly. We are, as I said before, taking into account all your feedback, all your questions, and everything that has been coming in, both before the webinar started and during the webinar. You're going to be receiving via email after this webinar with a quick little feedback form that we hope you have a chance to fill out. This This feedback form will be instrumental in figuring out what not just our upcoming topics will be, but for our webinars, but it will help inform what we know to be the high level information or questions that you might have. So please take a second, fill out that feedback form. You'll also be able to get some information in that post webinar email with how to access the recording, where it'll exist on the website, so that if you want to watch it again later and use it as a resource, or if you want to share it with one of your colleagues, one of your friends, your family member, please feel free to do that as well. So on behalf of Ostomy Canada, on behalf of John Hartman, who is our executive director behind the scenes here with us, Yasser, who has been doing our IT behind the scenes as well, thank you. Thank you again to Leslie, and thank you everyone across Canada for tuning in with us tonight. Have a great rest of the afternoon and great evening.